Everyone, I am so happy to be here. I'm actually recording this video for all my health professionals, and I want to start out by just posing a question. Have you ever had a patient doing everything right and still not getting the results they deserve? They're compliant, they're motivated, they obviously trust you, and you're both putting in the work, but the progress doesn't fully match the effort. All been there, right? So if you're a medical provider who maybe has gone to the other side, maybe more that natural approach, you're a, licensed naturopathic doctor or a certified naturopath, you're a chiropractor, maybe you're a nurse practitioner or and really any type of nurse, certified health coach, fitness trainer, nutritionist, just anyone in the health and wellness space, even estheticians and massage therapists, you've likely felt this in practice or when you're working with people. Their labs are improving. If they're getting their labs and you're looking at them, they are feeling better and you're refining their protocols maybe 8 to 12 weeks, and yet you start to feel like you're going in circles, like just becomes vicious, right? Needless to say, that is super frustrating, not just for you, but really for them. And that tension between effort and response is where I really want this conversation to begin because many chronic cases share deeper regulatory impairments. We have endothelial dysfunction, impaired tissue repair, mitochondrial insufficiency, metabolic inflexibility, and that persistent low grade inflammation that's either systemic and or isolated. Like they just don't feel good. They maybe have those low aches. Maybe they're in their 50s and 60s and just feel like they're so much older than they are. And when those symptoms that create these things are compromised, foundational care alone, honestly, it just isn't enough to restore the full function. And I say that from experience. I've been in practice at this point in 2026. I have been in practice over 15 years. I have supplemented strategically. I've a lot of supplements at sometimes. I have run comprehensive blood labs, advanced metabolic panels, thyroid, full thyroid, gut and brain related panels, hormone testing, DNA testing. I have built personalized dietary strategies and protocols. I've created exercise programs. I've used detox protocols, frequency technologies, light therapies. I feel like I've done it all, right? And yes, foundational care absolutely matters. A lot of things I mentioned, they are super important and should not just be thrown out the window. But there's still something missing. Patients, if they're compliant, they're committed and they're doing the work. And when their outcome stalls, they're gonna get frustrated. They're gonna get frustrated with you, and they're gonna go to someone else. And I wanna give you an example. I decided to change the way I practice early in, or I should say mid-2025, when I was referred a female patient, age 60, very active, very intelligent. Like, this woman knows what to do. She knows how to work out. She knows how to eat. She's disciplined. And I'll just say it was about last decade, she had gained weight steadily, unable to lose a pound here and there, but never could keep it off. Her sleep disrupted, her cognitive clarity declining, mood, let's just say, not great. She felt inflamed all over her body. She felt defeated. She was frustrated in her own body. Like, at age 60, you kinda get to a point where you want to be like, I don't care." But when you want to look good, you want to feel good, and you don't, that makes you feel depressed and gives you a lot of anxiety. And, when I looked at her labs, they did show mild concerns, but nothing emergent. Her physicians that she was working with, they already had her on one or two meds, but they were preparing to add medications. I'm telling you, she wasn't sick, but she wasn't well. Now, historically, I would have ordered testing, a little deeper testing for, I would have said, "Okay, let's run the hormones because we know that that's could be an issue. Let's maybe do some genetic testing." I've done tons of genetic testing in the last 10 years. And, maybe we need to do some expansion on some of the panels that we're looking at. And I will say there definitely is a value in that, but just something inside me said, "This time, I wanna take a different direction." So I said to her, "Can we just try something simple first? I wanna see if we can get some of that low-hanging fruit and you take care of some kind of those some simple things, like, let's just get you feeling good again and stabilized." And I just started her on a low-dose peptide protocol, and I told her we'd reassess in a couple months. And then from there, we'll investigate kind of doing maybe some additional testing. And I am not kidding, to both of our surprise, but the person who referred her to me texted me and said, "Oh my God, what are you doing with her? Because she looks like a whole different person." And then she came in to see me, and this was some of the things within this is 2 weeks, 2.5 weeks post her starting this very simple protocol. Her sleep improved. Now, if you know anything about sleep, if you don't sleep good, you're gonna have cravings, you're gonna be irritable, you're gonna have more hormonal, like, you're gonna store more fat, like, there's all those things that are related to sleep. Her weight began now shifting to the tune of 13 pounds in 2 weeks, and this isn't muscle, this isn't fat, maybe a little bit of fat, but this is inflammatory weight. That was gone now. She was noticing that she had none of the stiffness that she had before. Her face, all the puffiness was gone. Her mood totally stabilized. The anxiety gone. She was noticing that over the last few years, she had been super anxiety. That was one of the medications she was on. Cognitive clarity totally improved. And I'm not gonna say this happened overnight, but definitely within the 2 weeks, these things just kept piling on as benefits. And for her, this was life-changing. She was finally getting results. She was finally feeling a little more like herself again. And, here's the thing. This really forced me to kind of reconsider how I do kind of intervention and testing because it gets very expensive, like in the tune of well over $1,000 if you're doing it all. And what we have to remember is sometimes physiology needs regulatory support before it needs actual diagnostics. And sometimes signal needs to be corrected before we even dig a little deeper. And that's when I just kind of began integrating peptide therapy much more intentionally, not just for the metabolic regulation, but for tissue repair, mitochondrial and cell health optimization, immune, just so much thing. There's so many things that different peptides can do. Now, I know we all know that peptides are short chain amino acids that function as signaling molecules in the body, right? 101. But what we kind of don't think about is how incredibly important they are to our overall health because of what they actually do in the body. They don't, and the one thing is they don't override physiology. They modulate those regulatory pathways, the repair pathways, the metabolic pathways, the inflammatory balance, cellular energy production. It's so many other things, but they work upstream. This isn't alternative medicine. I mean, that's we kind of think it is, but this is not alternative medicine. This is next layer medicine. Hear me on it. It is not going away ever. And new RFK just released new information about how they're going to be addressing peptides. And I'm telling you, they are not going away. And I will say, for years since the big Ozempic thing came out and peptides became more mainstream, a lot of clinicians, especially in that natural health side, and I was one of them before I did a lot of research, we avoided peptides. And understandably so, let's be real, sourcing concerns, right? Research grade, gray market products. I think even the worst type of peptides won't kill you unless they're laced with something. That is a concern for sure. But you also don't want to spend money on things that don't work well, right? Or that could maybe cause you to have more side effects and symptoms, or there's no oversight. And a lot of the other problems come with liability issues, inventory management. It is not fun trying to regulate in your office peptides and who needs them because honestly, they do expire. So you have to keep a really good um, system to making sure you don't run out of peptides, right, for your patients. Working with pharmacies, it's another thing you have to worry about. State by state, prescribing barriers. Do you have people that you would like to help out of your state and your license doesn't allow you to do that? Maybe you are somebody who is awesome and you are a health coach or you are in the wellness space and you know your stuff and you know peptides and you love peptides, but you don't have an access to prescribing peptides. Well, now I am here to tell you you do. And so one with all of this kind of operational friction, I'll call it, it's pretty high and rightfully so. And now we just, like I said, we have the ability to wipe that out and it's all changed. And there's really only one company that I know of that actually allows non-prescribers or, even if you are licensed to prescribe, you can now take advantage of a 503A compounding pharmacy peptides that have total oversight, that are COA certified, that are triple checking when the peptide comes in raw form. Once it's been reconstituted, it's checked. Before it goes out the door, it's checked, right? State licensed physicians in every state. So there are in each state, there's a couple doctors in each state that will do the prescribing. So you can do cross-state prescribing, you can do in-state, you can do telehealth, you can have this built-in medical oversight that maybe you don't want to provide or maybe can't provide. You don't have to worry about inventory. You don't have to have any kind of storage liability or worry. And honestly, no dispensing risk, right? Um, the big thing is you don't have to stock this product. You don't have to worry about where it's coming from or anything like that. You don't have to manage shipping. And let me tell you, that's problematic at times. And you also don't, like I said, you don't have to navigate that the pharmacy logistics and all of that the stuff that comes with that. You get to focus now on your patients, their assessment and outcomes, their foundations, and just supporting them the best that you know how. And it's what you're already doing. But now you've just added this missing link to their protocol. And so this prescribing infrastructure really handles all the rest, the things that you honestly don't want to take care of anyway. So clinically, the applications are really broad. You have metabolic optimization and fat loss through the GLP based therapies. You have peptides for tissue repair, injury recovery, gut barrier support, neuroregulation, cognitive clarity. We talked about anxiety, mitochondrial optimization, muscle preservation and growth, having our growth hormone rebooted again, because that goes away like by age 30. So you want to look and feel younger. How about sexual health products? Oh boy, let me tell you, we have three of them that we have access to, and they get things moving. And a lot of people are really suffering with immune issues too. So we have immune modulation peptides as well. So trust me, your patients, your clients, they're researching peptides. They're hearing about them. And if they're not researching them yet, they will be. It is just a matter of time. And if they can't access them safely through you, they will access them somewhere else. And that is a promise. Often, of course, without oversight, they're going to whatever their, coworker got from whatever website and it's just hit and miss in this and just kind of flying by the seat of her pants. We don't want that for our patients. And honestly, this isn't about replacing what you do. You still do what you do. It's about enhancing what you do. If you're a practitioner who really does feel this frustration, you relate to what I'm talking about, knowing your patients need more, but you're just really not sure what or how to start, and you're ready to expand your toolkit without expanding your, let's say, liability, we need to talk. This has just been one of the most scalable, low friction addictions I've ever integrated into my practice. I just can't even express with words. And all I have to say is it could be the missing link in yours. And if this conversation, like I said, if it resonates with you, I would absolutely love to show you how this integrates operationally. All you have to do is you can send me a direct message through Messenger and I can send you my scheduling link. I'm happy to do a discovery call with you. And let's just find out if, first of all, if peptides are right for you. Maybe you just have some questions about peptides and you don't know where to begin. I can help kind of drive you down that path too, just to get you better understanding how unbelievably important peptides are, not only to your practice, but absolutely to your patients. So I hope this call resonated with you and I would love to set up that call. So please reach out to me and we'll get that call scheduled.